In this video, I want to discuss an exciting, innovative, maybe emerging therapy for fracture healing or broken bones, and those are exosome injections. This isn't a standard treatment yet, but it's getting a lot of excitement in the regenerative medicine world, and I think it's important to talk about it so you have a better understanding what's real, what's coming, that type of thing. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. As always, I want to start with a quick disclaimer. This is not medical advice. It's only meant, I should say, for information and educational purposes only. Also, when we're talking about regenerative medicine, most of the treatments that I discuss in these videos, and especially here with exosomes, these are considered experimental, especially with the FDA. They're not approved. Insurance won't pay for them. I'm not promoting them. I'm not telling you should do them. I just want to put more information out there so you can kind of understand it better, understand how they might be helpful. Talk to your doctor about it. You can certainly talk to me about it. Again, I'm not promoting my practice by any means, but I just want to put more information out there. But please know that these are experimental treatments. All right, first, let's talk about what exosomes are. I think everybody pretty much understands what a broken bone is. Exosomes are really small, naturally occurring vesicles. Some people refer to them as microscopic bubbles or microscopic envelopes. They're released by stem cells naturally in our body. In this case, the treatments, exosome treatments, they're usually mesenchymal stem cells that come from bone marrow or adipose tissue or umbilical cord, amniotic fluid, things like that. But these exosomes, these little microscopic bubbles, carry proteins, they carry lipids, they carry bioactive material that are released by a stem cell, and they influence other cells' behavior, communication, trying to get cells to regenerate, proliferate, differentiate, that type of thing. But unlike the traditional stem cell therapies out there, there's no cells that are being injected in exosomes. So in theory, they offer the benefits of stem cells without some of the risks, the theoretical risks with injecting live cells, immune rejection, in theory, tumor formation, things like that. Now, specifically when it comes to fractures or broken bones, the healing, you have to understand, it's a complicated process, very complex. Inflammation, then bone formation, then bone remodeling. Some fractures, when you're looking at older patients, maybe diabetics, in bones with poor blood supply, heal either really slowly or don't heal at all, leading to delayed unions or even non-unions. Ignoring even the older patients and diabetics, you think of the navicular in the foot. You think of certain parts of the shin, the tibia, and a number of bones that are really, really prone to non-unions. Well, maybe exosomes could be a way to decrease the risk of those non-unions. And there's studies that show that exosomes are very good at that, at least in a lab model, at promoting healing by stimulating what we call osteogenesis, or the growth of new bone, as well as angiogenesis, the formation of new blood vessels to bring nutrients, healing nutrients, into that fracture site. Now, studies have looked at exosomes derived from bone marrow mesenchymal cells and have shown that they enhance, again, another technical term, but what we call osteoblastic activity, bone formation activity, as well as reducing inflammation. Again, these are early studies, but so far at least very exciting. The studies have been animal models for the most part, but looking at rats with type 2 diabetes, they found that exosomes accelerated fracture repair. Another study looking in mice, and those, they used bone marrow derived mesenchymal stem cells. They took models actually where the fracture had progressed to delayed healing, not quite non-union yet, and showed improved healing of those fractures that were already in that delayed healing area, so to speak, and got them back towards the healing route. So that was definitely good. Again, what they found in those mice studies is that they basically promoted stem cell proliferation in that area at the tendon bone interface, caused accelerated healing. That's actually also been looked at ACL reconstructions to potentially enhance improvement of the graft incorporation into bone, and potentially doing that much better than what the body does naturally. Again, this is very early. We're going to need years of data, especially long-term data, especially in humans, and especially in trials that compare them to controls or standard treatments. but the potential is very exciting. And I think that's where hopefully this data pans out. It's certainly looking good in animal models, but not everything, it's important to know, with animal models always then turns around and works in human models. But it is potentially something that's exciting, potentially better healing, faster recovery time, less pain, hopefully better outcomes. So this is something that we're going to see studied a lot more, and hopefully we see this coming as honestly a very new innovative treatment for non-healing fractures, potentially helping you avoid bone graft, revision hardware surgeries, and a number of different things. But again, you do have to be cautious. This data is mostly lab data, cellular data, mostly animal studies. We don't have much in the way of human clinical trials, or if they are, they've just started. We don't have large-scale trials yet. Again, they are not approved by the FDA for orthopedic use. They're classified as a biologic. And that's where hopefully we'll get more data, although I still think that they're going to be experimental. I've talked about this in other places. These treatments are going to be experimental for the foreseeable future. I don't expect the FDA to all of a sudden approve these anytime soon. But it is something that's worth knowing about. It is potentially exciting, but talk to your doctor. Talk to somebody that does regenerative orthopedic surgery. This may be something that you want to know more about. Again, exciting frontier, but we have a long way to go. But there is, especially in the area of fracture healing and delayed unions, non-unions, hard to heal fractures, maybe this will be something that helps really take us a step forward. But again, it's important to talk to your doctor about this. All right, I have written an entire ebook I'd love to share with you. It's called The Arthritis Solution, but it's not just about arthritis. It's about all different types of orthopedic injuries and all different kinds of regenerative treatments, anywhere from supplements to modalities to injections, peptides, a number of different things. So if you want that, it's completely free. You can get that by clicking the link in the description below this video. If you have an orthopedic injury and you want to hear about options other than the traditional surgery or cortisone shots, there's a link in the description under this video. You can click it, be taken to a contact form, fill that out, and potentially schedule an appointment to see me. Also, I'd love to hear about your experience with your injury, whatever it is. You can leave those in the comments below this video. Just understand, if you leave a question, I can't offer you medical advice, but I might answer your question in a future video. Also, make sure to subscribe to this channel. Click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.